So with Skinfold measurements, this is a great technique used when looking at a population that their body composition hasn't been tested or hasn't been validated using other equipment. So most recently we used it in a research project looking at women that were pregnant in their third trimester. So the bod pod, we did that on them, but we're not sure if they count this extra mass in their belly as just fat, or if it breaks it down, because there's not really an equation for a pregnant woman. So Skinfold, there are I think 9 different sites on the body that you can take Skinfold measurements from, and there are equations associated with those. So some equations, they want you to use 3 Skinfold measurement sites. Some, they're asking you to do 5 or 7 Skinfold sites. So it sort of depends on which equation is the most specific and tailored to the population that you're looking at. Super inexpensive as compared to the other ones. I mean, by inexpensive, it still costs about $250 for this little contraption. But portable, and it doesn't cause a lot of pain or discomfort in people. I mean, I always try to joke with people, you know, I'm going to jiggle your fat a little bit and give you a pinch, but it's not really that distressing. The cons with Skinfold measurement is it's really, you have to send it back to the manufacturer if it needs to be recalibrated. So it's not something that if the calibration is off, I can just, you know, turn a couple screws and it'll be fine. I have to actually wait a few weeks, send it back to the people, and wait until it comes back. So that can be an issue. The interperson variability is definitely an issue with Skinfold measurements. So if on a study you're having one person do Skinfold measurements at the first visit, you really want to make sure that that same person is doing the Skinfold measurements at the second visit, because there's more chance that the difference between 2 different people doing the measurement would be bigger than the actual difference that would occur to the body in a certain period of time. BIA, or bioelectrical impedance analysis, is what I was talking about earlier with the Tanita scale. So the Tanita is a brand that any BIA I sort of refer, oh, the Tanita scale, but that's just because Tanita is the brand or the manufacturer of most BIA equipment. So BIA, it's great because you can use it in a variety of different populations. It's pretty portable. You can either roll them or a lot of them come in bags. You can take them. Some may or may not need electricity. Some I think can come with like a battery powered adapter if you need, but most take an outlet. So you could use it at a health fair. I've used it at many health fairs before, where we just have long extension cords and we're able to plug it in. And that's great because it's super quick and it gives a pretty accurate picture, as long as the people are well hydrated. Ideally, they won't have had anything to eat or drink for 2 hours, and they won't be wearing any metal. But for basic, you know, getting 100 people through, the Tanita scale is a really great tool. And minimally invasive, people don't feel anything. An electrical current is being sent through their body, but it's not something that will harm them. Disadvantages, it's not as accurate. It's really, it's not as accurate as say the bod pod or the DEXA. It's really affected by changes in body water. So if somebody were dehydrated, it wouldn't give you a very accurate picture of their body composition, or like in the pregnant woman where they've got a lot more body water than the typical person, their age and weight and gender, it might not give that great of an answer as well.